Hello, I'm Dr. Shruti Ghatalia, pediatrician, neonatologist, allergy and respiratory specialist. I've had my training in medical practice from Bombay, Vellore, Ahmedabad and USA. I'm attached to Zainova Shelby Hospital right now. In my 22 years of career, I've treated thousands of children and also some of them being childhood cancers. February is the month of cancer awareness and 15th February is the International Childhood Cancer Day. So this is the right time to create awareness about childhood cancer, and therefore let's discuss about cancer today. What I'm going to talk today will mainly incorporate what symptoms and problems in your child could be a red herring that you must go to a pediatrician for, and is there anything that you can do to prevent cancer in your child. Do you know, world over, more than 3 lakh children are diagnosed newly with cancer every year. And what is India's contribution to that? More than 50,000 children we diagnose every year in India with childhood cancer. There is a survey done in USA where they found that 1 in every 285 child cancer by the time he or she celebrates his 20th birthday. So cancer is not only a disease which is causing great pain to our children, but it causes immense emotional trauma to the entire family. Still not reached that stage, but that is why the importance of picking up our patients early. Now a lot of parents ask me, what is the difference between childhood cancer and adult cancer? See, adults have cancers involving organs. So you will see a lump in the breast, you will see bleeding changes in the cervical bleeding pattern. You also have very good screening techniques to screen cancers before they manifest in an adult. Now this is not so in a child. Now most of their cancers are in tissues like blood, lymph. They're non-specific signs and symptoms. The child himself cannot understand and cannot explain to you. You cannot see a particular symptom or sign which will tell you that this child is going to have some major problem. We don't have screening mechanisms, and therefore the problem that most of them when they come to us have disseminated cancers. So today let us first talk about what are the symptoms that we must look for in a child so that bell rings in our mind to go to see a doctor. First and foremost, a child who is losing consistently weight without any reason. For the last 1 or 2 months, you feel that your child has just started losing weight for no reason at all. Secondly, a child who is chronically tired, गोरा होना अच्छा नहीं है, वो फीका हो गया है. Another important thing, if a baby has recurrent fevers without any infection, so every 15-20 days, 1 month, your child is having fever and you are not finding any cause or any infection which can be attributed to that fever, then that is a red herring. A lot of kids with cancer present initially, especially headache in the morning associated with vomiting. Sometimes these headaches are so bad that the child just cannot do the daily activity, or these headaches are progressively increasing. So this week is worse than last week so far as the headache is concerned. Some torch in their eyes, one iris will shine like a cat's eye, or in a picture you will find that one eye is looking a little reddish, or the iris of the child changes color. So these are signs that you might be having some problem with the eye inside. You may also in the neck, in the armpit, chest on x-ray, abdomen, pelvis. These are alarming signs. Some children have persistent pain in the bones, in the legs, they have joint swelling, they have backache, they have long time leg aches to be investigated. So a child, it's very difficult to tell you what all the baby will come. Reiterate, remember, any child who is suddenly becoming white is leukemia, and about 16-17% are the lymph cancers. So you can understand these are hidden cancers which are very difficult to pick up at early stage. And therefore, see the rest of the ones, the brain, the liver cancer, the an alarm bell in our mind. So any child who has recurrent fever with bone pain, or a child who suddenly becomes pale, swelling in the neck, or a child who has abdominal swelling. So we say hepatosplenomegaly. The liver is enlarged, the spleen is enlarged, and the baby has rash on the body. Or when you do a CBC, you find that all the cell lines are low, or the WBC count. You always think this is genetic, inherited. My parents or grandparents gave it to me. But in childhood cancers, only 5 to 10% are genetic cancers or inherited cancers. So what happens when a baby was fertilized? Either the ovum or the sperm had these genes in the DNA which came to the baby, and eventually those genes manifested into cancer and the baby presented with the disease. But it's just 5 to 10%. So आपकी फैमिली में किसी को कैंसर हुआ है, इसका मतलब ये नहीं कि अगली 3 पीढ़ी में सबको होने वाला है. Therefore, of course, some children, a subgroup, have predisposition to cancer. So जैसे किसी को congenital anomalies हैं, जन्म से ही कुछ खोड़खापन है, they have some syndromes, like they have still have something in our hand to control and protect our children from getting cancer. Okay, so this was a little bit on symptoms, and now myths and facts. So let's talk about the myth. से जाता है, सोचते हैं मेरे बच्चे की जिंदगी तो खत्म. ऐसा नहीं है. They live a full life. So many of them go to school, go to universities, get a job, get married. In fact, there are several with cancer. You shake hands, you hug them, you live with them in the same house. One thing that people are really worried about is stress and chemicals in hair dyes and deodorants. लोगों को लगता है इससे मुझे कैंसर होगा. But there is no real scientific data connecting these to cancer. So deep fry, when you make your potatoes very brown and crisp, you fry them at very high temperature. That releases acrylamide and that is a carcinogen. So अपने frying थोड़ा pale रखिए. Sunlight, हम लोग सुखी हैं क्योंकि हम काले हैं. We have melanin which is protecting us. This is more of a problem of white skin people. But too much of sunlight exposure, especially 11 से 3 के बीच में दोपहर में, will tend to cause skin cancers. So wear a sunscreen and don't go out in the dead heat 11 to 3. Processed meat खाने nitrates in the डब्बा. Tobacco is a killer. कोई भी tobacco, मैं mild लेता हूँ, मैं light लेती हूँ. It is going to cause cancer to your unborn baby if you are smoking during pregnancy, and it is going to cause actively cancer to you and passively to your child. It is a quiet, odorless gas called radon, which comes from soil and stones. And this, if it creeps into your house, especially a non-ventilated area like your basement, you are fired. BPA, बहुत माएँ अभी जागृत हो गई. आप जब टिफिन बॉक्स लेने जाते हो बच्चे के लिए, अभी नया साल चालू होगा स्कूल का, वाटर बॉटल लेंगे, ऑलवेज बाय BPA फ्री प्रोडक्ट्स. हम प्लास्टिक को जब गर्म करते रहते हैं तो ओवर अ पीरियड ऑफ टाइम इट बिकम्स कार्सिनोजेनिक फॉर योर चाइल्ड. गर्म खाना प्लास्टिक में नहीं परोसिए. एंड एडल्ट्स, अल्कोहल किल्स. So all this was something which can be used as a preventive. हम सोच रहे हैं कि मैं बच्चे को कैसे प्रोटेक्ट करूं कि कैंसर ना हो. सो व्हाट शुड बी अ आइडियल लाइफस्टाइल कि को प्रोटेक्ट कर सके. फर्स्ट एंड फॉरमोस्ट, बहुत अच्छी वैक्सीन हैं. It's caused by viruses, and this vaccine protects all children from cervical cancer. Cervical cancer is the second most common cancer in India today. और 9 साल से बड़े बेटे या बेटी को आप ये वैक्सीन देके प्रोटेक्ट कर सकते. And early and accurate diagnosis and timely treatment is the only way you can fight childhood cancer, improve the survival of your child, and reduce your child's suffering. We can always discuss the lifestyle that your child is having and therefore what measures can be taken to protect your child from cancer.